I'm Ivana, one of the senior medical content writers here at Pabau. A microneedling treatment form is a clinical document used to record essential information before, during, and after a microneedling procedure. It exists to capture the patient's medical history, skin assessment, treatment settings, consent confirmation, and treatment outcomes. This form creates a clear, consistent record that supports safe care and allows practitioners to monitor progress across multiple sessions. This form is important because microneedling deliberately creates controlled micro-injuries in the skin to stimulate collagen production and repair. Patient factors such as active skin conditions, medications, history of scarring, or infection risk can significantly influence safety and results. Accurate documentation helps reduce complications, supports clinical decision-making, and provides accountability for both the practitioner and the clinic. In day-to-day practice, the microneedling treatment form is completed during consultation and reviewed at each appointment. It guides the practitioner through assessing skin type, treatment goals, and contraindications. During treatment, it records device type, needle depth, treatment area, and patient tolerance. After treatment, it documents skin response, aftercare advice, and follow-up plans. Before and after photographs are commonly taken and stored with the form to objectively track skin changes over time. Key considerations include reassessing the patient's medical history and skin condition at every visit, as suitability can change. Treatment settings such as needle depth and number of passes must be documented accurately to ensure consistency and safety. Common pitfalls include incomplete skin assessments, unclear recording of settings, or missing aftercare instructions, which can increase the risk of irritation or infection. Step 1 is to complete the patient's details, medical history, skin assessment, and treatment goals during the consultation. Step 2 is to confirm informed consent, explain expected outcomes and downtime, and take clear pre-treatment photographs. Step 3 is to document the microneedling device used, needle depth, treatment areas, number of passes, and patient response during the session. Step 4 is to record post-treatment skin condition, aftercare advice, follow-up timing, and attach post-treatment photos when appropriate using a tool such as Pabau. In summary, a well-completed microneedling treatment form supports safe practice, consistent treatments, and reliable clinical outcomes. Visit our website where we have over 6,000 free templates and resources to choose from.